I've done a lot of videos on the immune system. Today, we're going to talk about what to do once you get an infection and what is the fastest way to overcome this infection. Well, the first thing to do is to kind of figure out or guess if it's more a viral infection or a bacterial infection. So with a viral infection, it's going to be more systemic. So you're going to probably feel more body aches, chills. With bacterial, it could be more localized to like lymph nodes or maybe a urinary tract infection or food poisoning. A fever in a bacterial infection goes a little bit higher than a viral. So if your fever is really super high, potentially it could be more bacterial. If you get a sore throat with a viral infection, a lot of times you'll have a runny nose and a cough. But with a bacterial sore throat, you're going to feel just like more pain and localized without the runny nose. That's a type I used to have every single year growing up. It was terrible. With a virus, you'll have more of a dry cough, bacterial, productive cough, which means there'll be mucus involved. Typically, when you have a respiratory infection, sinus or lung or bronchitis, think viral. But if you have pneumonia, you can have both bacterial and virus, except sometimes in a childhood illness, you'll get pneumonia, viral pneumonia. But if you have like the common cold or a flu, that's typically going to be viral. Now, as far as how long these infections can go, with a viral, it could be 1 to 2 weeks. With the bacterial, it could be a little bit longer. And this all depends on your immune system. The mucus with a viral infection usually is clear or white, but with a bacterial infection, it's more green or yellow. There's a couple remedies that I recommend for viral: elderberry or olive leaf extract. For bacterial, I would recommend garlic, oregano oil, and echinacea. Think about echinacea. If you can catch this infection in time and you take echinacea, you can sometimes stop it from going into a full-blown infection. Now, at the very end of this video, I want to reveal something very important about a sore throat. It's a technique. You want to take a hot bath or hot shower and dress very, very warm to the point where you're even sweating. Why? Because we want to cook the virus or bacteria. We want to heat you up to the point where we can kill off this infection. The side effects from this infection really are your immune system killing off the microbes, and your normal cells are also being affected. So really think about this as not a bad thing. It's just that your immune system is working. Go to bed early. The more sleep you can get, the better. A lack of sleep will really weaken your immune system. I think it's really important to take zinc, vitamin D, and vitamin C. Fasting, I think, is a very, very good thing. That way you're stimulating your immune system and allowing your immune system to work. And when you fast, you actually increase your survival genes. They start to kick in, and there's a lot of benefits from fasting that go way beyond just your immune system, but fasting will help your immune system. Sea salt is a very important thing. Sea salt also helps increase the parasympathetic nervous system and decreases the sympathetic nervous system. Sea salt can help you sleep at night. The other thing that's really important is to do whatever you can to improve your emotional state, whether you have anxiety or depression. Go for a walk, listen to music, do something to pull yourself up, because infections last longer in lower emotional states. The sun gives us many cool things that go beyond just making vitamin D. It also gives you UVB, which is anti-inflammatory. Also, the sun gives you infrared. And infrared can do a lot. It's anti-inflammatory. It can increase melatonin. It's immunoregulatory. It helps sleep, repair, enhance the mitochondria. It can increase killer T cells. And it can even dampen the cytokine storm. Many, many, many times when people get sick, there usually is always some type of predisposing factor, like some type of stress that allows this infection to take over. So anything you can do to reduce that would be very, very good. And this is why they give prednisone, which is a synthetic version of cortisol, to any type of immune problem that someone has, and it gets rid of it. It suppresses it. If someone is low in vitamin D or zinc, they can be more susceptible to having an infection too. Also, you should make note that when you eat refined sugar or refined food. That can deplete zinc as well as vitamin C. The chemistry of vitamin C is similar to glucose. And so if you're consuming any type of sugar while you're consuming vitamin C, you're going to block the absorption of vitamin C because the body's going to take in the sugar. As we age, the thymus gland, it's a little gland on top of the heart that really is so important in training your T cells. It starts to shrink as we age. So when we get older, our immune system gets weaker, unfortunately. If you have microbial imbalance in your gut flora, or you don't have enough microbiome diversity, that can put you at risk for having a problem as well. And of course, sometimes people have this idea that I'm going to try to kill off this infection by, doing a shot of whiskey. No, I wouldn't do that. It's not going to help you. And another good remedy is cod liver oil. Why? Because not only does cod liver oil have the omega-3 fatty acids, which are anti-inflammatory, but it has vitamin D and vitamin A, which supports your sinuses, your throat, your GI tract. I used to have a lot of sore throats. And in practice, there was something that I came up with that I think is mind-blowing. And it's one of those things that you just have to try out to believe it. And I have a video that I'm going to put up that you can watch. It's a simple technique that someone can do on you to help give you relief of the soreness of your throat infection. Now, I'm not saying it does anything for the infection, but it'll definitely reduce the pain and soreness that you have if you have a sore throat. So what you're going to be doing is you're going to have someone press on the exact opposite part of where the sore throat is. So if you have a sore throat like right through here, you're going to have someone pressing on the back part of your neck. To get a full detailed understanding of what it looks like and how to do it, I put that video right here. Check it out.
Hey, Dr. Berg here. In this video, we're going to show you something extremely powerful. In fact, it borders on magic. Now, what we're going to show you to do is how to improve and fine-tune your vocal cords and actually improve laryngitis, sore throats, hoarseness with your vocal cords. And this is great for if you're a singer. I've been doing this for the last several years on opera singers from Juilliard, university instructors for singing, vocal coaches, singers all over the place. And so what you're going to do is I'm going to show you how to do this to someone else and on yourself. And here's what happens. A lot of times people get laryngitis and then they have to take an antibiotic or take a steroid. And I think that's why a lot of opera singers are very, very large, because steroids have a side effect of weight gain. But steroids are adrenal hormones, and the reason why they do work, yet have side effects, is because the adrenal gland is intimately involved with your vocal cords. They have receptors for steroids. So steroids are adrenal hormones. And so what we want to do is we want to give you some natural solutions. Now, this is in no way, shape, or form used to a substitute of treating any type of disease or illness. So I'm not claiming to cure your viruses or your bacterial infections. So that's not what we're doing. But this gives you an alternative. Okay? So let's say you had a sore throat or laryngitis or hoarseness, or you just wanted to fine-tune your vocal cords. Typically, what happens is viruses can come out of remission when you're stressed and lodge into the vocal cords and actually cause the whole vocal cords to shut down to the point where you can't talk anymore. So viruses, you can't kill them because they're not alive. They're a piece of genetic material wrapped in a sac that come out of remission and go back in the remission depending on the state of your health or stress level. So here's how it works. If we go backwards, there's always something that lowered your immune system, that made you susceptible to pulling in that virus or weakening your immune system. So there's always an earlier stress event that very few people look at. So we have the stress event, lowered immune system, boom, you get sick, or the virus, whatever the cause is, okay? So we're not treating this stuff right here. What we're going to do is remove the stuck stress that actually lodges in the throat. So we're going to show you how to do this in the next video. And make mental notes, because if you ever have a laryngitis or a sore throat, apply this And it usually takes about 2 minutes to improve this. So it's very, very fast. It doesn't have to take a long time. And all we're doing is removing stuck stress within the vocal cords, but we're doing it in a unique way. So check this out. Okay, so in step one, what we're going to do is we're going to locate where the person has the sore throat or laryngitis or a tickle or any type of hoarseness. And usually it's going to be right down here by the vocal cord. So you're going to have them point to where it is, and then what we're going to do is we're going to draw a line around the back of the neck. So I'm going to actually have you sit this way. Let me move the chair this way here. Okay, good. All right. So we're drawing the line. They're going to point right here, and we're going to draw a circle right around the back of the neck right here. And there's usually a little bump right here, okay? And then you're going to come up about 1 inch. That's right at the back of the vocal cord. So we're going to take our 2 fingers, our middle finger and our thumb, and we're going to press kind of down. I'm going to take the other head and stabilize the forehead as I press into the opposite part of where their vocal cords are. And the most important thing you need to do and remember is make sure you do not mess up the person's hair. And I'm going to hold this pressure, you can see right here. I'm going to push pressure there. I'm going to hold that for about 2 minutes. Now what's interesting about when I do this is that sometimes you're going to have to be a little higher up because sometimes their irritation is a little higher in their neck. So you'll try to find out where it is, and then when you press, the way you know you found it is it's going to be very, very sore. In fact, more sore than the sore throat. So there's going to be really a hot spot through here. So you're going to press on the soreness, use pressure to their tolerance, and you're going to hold this for about 2 minutes. Okay? And then you're just going to ask them when the soreness goes away, and then you can stop. Now, if you want to use a device, you can use this on yourself or on another person. This is a device that I created, which is a kind of a do-it-yourself acupressure device. It looks like this. It's a tripod because you could literally put this in the back of your neck and lay it on a couch or your pillow on your back and let gravity put pressure on your neck. So with her, because her neck is fairly thin, we can use the real small little spaces right here. If the neck is bigger, we can use this right here. So we're going to press right into this spot here, and this makes it really easy to apply pressure. And we're going to hold this for about 2 minutes, and it's going to be a little sore, so adjust the pressure based on the person's tolerance, and then you're going to ask them when that soreness goes away. And if they have laryngitis, you're just going to kind of test it, maybe have them count to 10 or something like that, and it's going to improve the quality of that voice. If they have raspiness or let's say it's a little tickle, the key is having a point to where it is, go exactly opposite, press opposite point and hold this for 2 to 3 minutes. And you're going to apply this pressure at least 3 times a day for a couple days, and that should clear it up. On many cases, all it takes is like 1 2-minute acupressure to actually clear up the throat. So again, we're not treating the virus. All we're doing is removing the blockage by working on the opposite side of the blockage. So go ahead and apply this. Send me your comments below this blog, and I will see you in the next video.